neurological conditions under four broad categories. So this is purely based on my classification. You can't see this in any books. So if there is any flaws, you can excuse me and we can discuss about this. In all my understanding, I have divided these conditions into these four main categories, because the assessment and treatment more or less, I won't say exactly, more or less are similar for these categories. First category is the upper motor neuron lesions, where you can categorize your stroke, traumatic brain injuries, multiple sclerosis, brain tumors, brainstem disorders, and spinal cord injury in the upper motor neuron lesion. Okay, I mean to say spinal cord injury, not the spinal nerve injury. There is a lot of difference between those two. Next is the lower motor neuron disorders, where you have your peripheral nerve lesion, peripheral neuropathies, peripheral neuritis, entrapment neuropathies, radiculopathies, conditions like Guillain-Barré syndrome, poliomyelitis, which is the anti-Raynaud cell disorder. Next, we can also have next category is the movement disorder, where the problem is not with weakness or paralysis or anything else. It is the problem with the quality of the movement. So I can say the basal ganglia is the one which is responsible for producing the background activity for the movement, that is maintaining the tone of the movement muscles. So any problem in these structures can cause either an reduced timing of movement or increased timing of movement. That is, movement time is increased or movement time is diminished. Paucity of movement or abundance of movement. So the basal ganglia is a very important structure, and along with that, your cerebellum is also playing an important role as a comparing component of the movements. So these two things put together in the movement disorder. Normally, if you go to the neurological books, movement disorder means they will say only Parkinsonism, chorea, athetosis, balismus, hemibalismus, all these things. But I have included cerebellar disorder here because the management and assessment also from a physiotherapist point of view are somewhat similar in controlling the quality of movement rather than the quantity of movement. Okay. Next, the fourth classification is the myopathies, neuromuscular junction disorders, where the problem is not with the nervous system, but the problem is in the interface of the nervous system. Who are the interfaces? The muscle is the major interface for the nervous system. You can classify your muscular dystrophies, myopathies, inflammatory muscle disease, and neuromuscular junction disorder, whether it is a pre-synaptic disorder or the post-synaptic disorders like myasthenia and botulism respectively. Okay, so this is the four main classification.